Okay, hello everyone. In this video lecture, we're going to explore how patient records are filed, organized, and stored. Okay, we talked about filing systems a little bit, but as discussed, in addition to the different numeric types of filing systems, we also have alphabetic filing systems, and typically this goes with the patient's last name, first name, middle initial. In an alphabetic filing system, we basically are using the patient's last name, first name, middle initial to file records and master patient index cards in alphabetical order. And again, how alphabetical it gets remains to be seen. For the most part, we start with the last name and we arrange these names alphabetically. We disregard any punctuation or close letters is one word, file them as one unit, and so on. Pretty straightforward stuff. Some advantages and disadvantages of filing system. Number one, it's easy to learn. Most people understand alphabetical order, so you can train new staff members quickly. You don't really need a master patient index, and record retrieval is performed quickly. Now, for the downside, if somebody misspells a name, you may never find their record, right? Because you can't find it. And misspelled patient names result in misfiling of records. And then records don't expand at even rate, right? So the A's, last names that begin with A's, there's not automatically the same expansion for last names that start with a Z. And then if a patient's name changes, you have to recreate the record in a different location and do a cross-reference, and it can be kind of a headache. The Soundex is a phonetic indexing system that allows surnames that sound alike but are spelled differently to be filed together. And the way we do this is we have a 4-character phonetic code containing a letter and 3 digits. So it's G123. And these are created using these 3 digits of 123 are created by using letters of the patient's surname except the vowels A, I, O, U, W, H, and Y. And then the alphabet's reduced to 6 key letters and their equivalents. So once these phonetic codes are assigned each patient's surcode, so the codes are arranged alphabetically by a given name. They give you the example here of Minnie Dwyer. Minnie 600 is filed before Sam Dwyer, D600. We talked about numeric filing, which is very, very common. And patients get a health record number, and the records are assigned according to that number. There are 3 different types of numbers: a straight numeric, terminal digit, and middle digit. What straight numeric filing is basically another way of saying consecutive numeric filing. So the records are filed in strict chronological order from lowest to highest. It's easy to train people on, but the problem is we get records transposed, misfiled, and then we have all this activity in one file area. We want to file reports into them because of this consecutive numbering. So it gets to be a little bit of a headache. Don't really see it used that often. With terminal digit filing, this is used because healthcare facilities assign medical record numbers in 6 digits, 3 groups of 2. So we have primary, secondary, and tertiary. The primary, the records that are located at the end of the patient's number, secondary in the middle, and the tertiary are at the beginning. right? So if we have numbers 1, 2, 3, 4, 5, 6 was the patient's number, we would start filing by the 6, the 5, and work our way back. And so a lot of record security on this because it's not as easy as just finding things in chronological order. The biggest advantage is, however, though, that the files expand evenly because you're not doing it on a consecutive basis. So it's easier to plan for filing speed, space, what have you. And then lastly, the inactive records are very easy to retire without moving all the records as you would with consecutive numeric filing, right? Disadvantage, there's a little bit more training time and more space and equipment, and you have to be organized about it. But this was the most popular way of doing filing, the terminal digit. Middle digit, which is kind of the same, is assigned some middle digits as a primary. The digits on the left is secondary, and the digits on the right is tertiary, right? And kind of the same thing, although the one downside is patient numbers have to be limited to 6 digits because otherwise you wouldn't be able to evenly parse these out and have them distributed evenly. So let's talk about how we actually file them. We talked about how we actually sort them. Now we're going to talk about the filing itself. In hospitals, the most popular way of doing it is to have a centralized filing system. And typically, these would be in the basement of a hospital and under the control of facilities health information management department. Advantage, the responsibility for record keeping is easily identified, makes more effective use of equipment, office space, and personnel, and consistent service is provided to all users, and improves security because the health information management people, anybody who wants access to records, you have to go through one person who has knowledge of the facility, policies and procedures, state law, what have you. Some disadvantages. The records may be far away from the patient care location. That is a little bit of a problem. And then it can result in increased personal filing systems. So in ophthalmology, for instance, they had what they called their own shadow filing system at Stanford. So they would keep copies of patients' retinal scans along with their little shadow systems, right? And it also requires additional staff to handle filing and retrieval of records when you have them in a centralized place. And then you need filing equipment. You need shelves, usually 3 feet by 7 and so on. You need filing space. Decentralized means we have the patient records, but they go out to the individual clinics or individual offices or departments. Advantage, biggest one is the records are located near the providers, near the patient care area. We also don't need extra space. And then the providers control what's filed and what's retrieved and so on. However, there are disadvantages. There's confusion about where patient information is found. Is it found in the decentralized chart or is it somewhere else? What happens if you have a patient who's seen an ophthalmology clinic and GI? Where do you get the information you need? And because things are fragmented, you have fragmented documentation, which is also a problem. And then with records being stored in different systems, you have lack of uniformity, lack of consistency in record keeping practices. And that's all I have for you. Thanks for watching. And we have our third and final video lecture where we'll continue our discussion on Chapter 7. We'll see you then. Bye now.